Can diagnostic tests detect microscopic colitis effectively? Have you ever wondered how doctors diagnose microscopic colitis? This condition can be tricky because it involves inflammation of the colon that isn't visible during a standard colonoscopy. Instead, the diagnosis relies on looking at tissue samples taken from the colon. So, can diagnostic tests effectively identify this condition? Microscopic colitis is characterized by chronic watery diarrhea, but when doctors perform a colonoscopy, the colon often appears normal. This is where the challenge lies. To make an accurate diagnosis, doctors need to take a biopsy of the colon mucosa during the colonoscopy. The biopsy is then examined under a microscope. This examination reveals specific inflammatory changes, such as increased lymphocytes or collagen been thickening. These changes are crucial for identifying the two subtypes of microscopic colitis, lymphocytic colitis and collagenous colitis. Colonoscopy with biopsy is considered the gold standard for diagnosing this condition. It allows for direct sampling of the tissue, which is essential for spotting those subtle microscopic changes that define the disease. Other tests, like stool studies or blood tests, generally do not provide the necessary information to diagnose microscopic colitis. They fail to show the microscopic inflammation that is characteristic of this condition. While researchers are exploring new molecular or biomarker tests, these have not yet replaced the biopsy as the standard diagnostic method. It's important to note that microscopic colitis is different from other inflammatory bowel diseases, such as ulcerative colitis or Crohn's disease, which typically show visible inflammation during endoscopy. Although microscopic colitis itself is not considered a precancerous condition and does not increase the risk of colon cancer, getting an accurate diagnosis is still vital. This helps manage symptoms and rule out other causes of chronic diarrhea that may have different implications for colon health. In terms of treatment, corticosteroids like budesonide are commonly used to manage inflammation in microscopic colitis. In conclusion, diagnostic tests can effectively detect microscopic colitis, but only through colonoscopic biopsy and histopathological analysis. This method is essential because the defining features of the disease are microscopic and cannot be seen through imaging or standard endoscopic visualization. If you have symptoms that suggest microscopic colitis, it's best to consult with a gastroenterologist for proper testing and personalized care.